Hello, everyone. Welcome. So today we're going to have a presentation from Jalen Little, who serves as an academic advisor in CHHS. If you can you please turn on your cameras? If you can't, we totally understand, but we do want you guys to be engaged throughout this presentation. And if you do have questions at any point, feel free to put them in the chat and we'll make sure Jalen gets a chance to answer them. You got the floor, Jalen.
All right, thank you so much, Tiara. I'm gonna share my screen in a few moments, but give me 1 second. All right, hopefully you can see my screen okay. Awesome. All right, y'all. So good afternoon. I know everybody's ready for fall break, so hopefully everybody have a nice smooth fall break and they are looking forward to a time to recover and relax a little bit. I'm just going to do a quick presentation that talks about the job search strategies when it comes to your major, or if somebody's interested in doing health systems management. Here's some tips and tricks to find some jobs related to this program right here. So preparing for the job search, it can be very overwhelming just thinking about like, okay, I'm about to graduate or I just switched my major to health systems management and I do not know what to do when it comes to find jobs related to this program. So I always tell students, or I always, I know the Career Center tells students that, hey, make sure you know yourself, make sure you know yourself as a professional. So what exactly are you looking for? What exactly are you passionate about? What are your career goals? Kind of ask yourself those questions a little bit before you start diving into the job search. Make sure you be familiar with the job industry too. So health systems management, we have a lot of graduates going into different avenues or different career tracks when it comes to this program. So I think it's very beneficial before you actually graduate to think about like, okay, maybe I should shadow some professionals in this field so I can figure out what exactly I do like and what exactly I do not like. So I know what to prepare for. And then lastly, make sure you be able to market yourself pretty good. It's good to have a good brand, a professional brand when it comes to applying for jobs. I tell students make sure they have multiple copies of resumes, like cover letters. Make sure they just update their professional social media accounts, so that way they be able to really build their professional brands with different professionals out there. Diving a little bit into the resume piece. So it's really important to kind of just start with the resume. So I always tell students maybe just write out just generally what you have done so far when it comes to your professional jobs. So that can be something that you're doing part-time, that could be a full-time job. It doesn't have to be exactly related to health systems management at this moment, just because you are just trying to figure out what have you done in the past or what are you currently learning right now in your current role. And then as time continue on throughout this program, you can figure out, okay, what kind of other skills I need to gain so that way I'll be more um, marketable when it comes to finding jobs and getting that job opportunity shortly after I graduate. So what would make a good impression of you? That's basically what I like students to do when it comes to their resume. Some quick resume tips. Definitely, I tell students to make sure that the resume looks nice and neat and very reading accessible. So want to make sure that you students or not students, so make sure that the professionals who are reviewing your resume, they be able to figure out exactly what exactly have you done in the past. So here's some little quick tips that tells you about the font size. So you want to keep it between like 10 to 12-inch font.
12-inch font.
Make sure that it's about one page. You don't want to have multiple pages just because a lot of times the human resources professionals who are reviewing applications, they get a lot of applications for one role. So they want to make sure they can be able to quickly pick up the professionals or the applications that really matches closely related to the job that they're hiring for. So keeping it one page would be very beneficial for you. So that way you'd be able to kind of mark yourself a little bit better. Definitely want to make sure that you are listing your experience in reverse chronological order. So pretty much just start with the most recent job that you're doing. So something that you're doing currently and kind of go backwards. So what was your most recent job that you're doing right now? And then what was your previous job that you did? And just talk about the different skills that you've done for each role. Consistency is very crucial too. So that kind of goes back to making your resume very user friendly or making it easy to read a little bit. So you want to make sure that your consistency is pretty straightforward and making sure that it's not kind of all over the place. So if you are making your alignments kind of the same for each job description or each professional role that you completed in the past, you want to make sure that it's aligned properly so that way the professionals can kind of move through your resume pretty quickly and pretty smoothly. use action words when it comes to your skills too that you developed during your previous roles. Sometimes it can be kind of intimidating to figure out like how can I describe what I've done in my previous roles in one bullet statement. So it takes some practice, but definitely use your use the resource that we have on campus, like the Career Services Center, to meet with different career coaches. But definitely, it's good to start with each statement with the action verb, so that way the professionals know what you have done. So something that I led a team, or I was able to manage different projects, and kind of go into more details about what exactly you done in that role later on in the bullet point statement. And it's very important to proofread too. So always have multiple set of eyes to review your resume so that way everything looks good, it looks neat, and is free from grammarly errors and stuff like that.
Jalen, there's a question from Jacob.
Yes. What's the question?
I
Let me
was
see.
just gonna ask, going back to that last slide, have you ever heard of putting a bunch of like keywords to a certain job that you want in the margins of your resume and then turning the font white just so that you get into that pool of like in a certain recruiter's pool? Have you ever heard of that?
I myself have never heard of that actually. I, that's kind of unique and interesting, I would say, but I never heard of that before.
Hmm.
I don't know if that's something that a lot of students are starting to do now, or young professionals are starting to do now a little bit. But I always tell students if they wanted to really, I guess, have their resume looked at by recruiters or professionals, I always tell them to make sure that they're utilizing the keywords that is in the job description throughout their resume, so that way the recruiters can see like, okay, we see that this person took the time to review this job description, and we see that they utilize some of the stuff from the past that relates to this job right here.
And Jacob, what I might do is next time you're at a one of our events, when you are face to face with a recruiter, like at a career fair, you can ask them that just to get their perspective of that. But I've never heard of it, kind of like Jalen. But I would recommend not doing that when you have like a physical copy and you're meeting a recruiter, not until like you get confirmation with them, maybe you hear this or see this around. Possibly you could do that if you have like a digital resume, and do some different things like that. Like definitely LinkedIn, that there's no really rules about that, but there are kind of set standards when you have a physical resume when you're giving it out to employers, and employers look at your resume for less than 10 seconds. So you want to make sure it follows these formats that Jalen is talking about.
Right. Thank you.
Yeah, thank you for asking that question, Jacob. We appreciate that. So networking, this is something that I always stress to the students I meet with, especially for those who don't really have a lot of professional experience related to health systems management, is the power of networking. It can be intimidating a little bit just because some people are not extroverts, and they like, I don't want to go up to that stranger and just let them know that I'm interested in this field. It's kind of hard to kind of start a conversation with strangers. But I think it's really important to just network just because you don't know who you might come across. And the people that you're networking with, they might know other professionals that they can get you connected with as well. So LinkedIn is a great tool to use when it comes to networking. And as you see some stats right here, about 70% of jobs are found through networking. When it comes to finding jobs, we have great resources on campus. I always tell students to first start looking at Hire a Niner when it comes to finding jobs in either in the city of Charlotte or the surrounding cities or in different states. And definitely you can filter different jobs within that Hire a Niner. So if you're a person that's looking for more so on the tech industry when it comes to maybe health IT or health information management, you can kind of filter your job searches related to that specific job. But Hire Niner is a great tool to start. I mean, there's other job industries or job searches engines, I should say, that you can utilize to find different opportunities when it comes to like internships or just volunteering experiences. But definitely take some time to check out Hire Niner if you haven't had a chance to do that yet. It could be overwhelming seeing all those jobs, but like I said, you can filter it so that way you can figure out which ones really match your interests. LinkedIn, I think it sometimes can be overlooked by a lot of students nowadays just because I think they feel like it could be overwhelming. I think sometimes students don't really know how to organize their LinkedIn account or how to really market themselves on LinkedIn. So Definitely LinkedIn is a great useful tool when it comes to networking, as I mentioned before. If you're not familiar with LinkedIn, it's basically a social network for business professionals. So pretty much it's like the Facebook business professionals. So you can follow people, you can follow organizations. You can also pretty much talk about what you have done when it comes to your professional field. So or your career field. So if you have skills that are related to the field you're trying to go into, you can list that on your LinkedIn account. Or if you're doing an internship currently right now, or if you're working part-time somewhere like at a hospital or retirement facility, you can list all that on your LinkedIn profile. So that way when somebody look you up, they can be like, okay, wow, we see that Jalen right here has this experiences working with Epic, which is like a software system that we want to utilize in our office. Maybe we should reach out to him so that way we can figure out what other skills he has, so that way we might can bring him on our team one day. Definitely make sure, kind of like with the resume, if you want to make sure your LinkedIn account is user friendly and everything on there is appropriate, always feel free to reach out to a professional. Either that can be like a professor or your academic advisor or somebody in the career center. They will be happy to review your LinkedIn account to make sure everything looks good. One little fun fact too, actually at the bottom, that if you want somebody or if you need to have a professional photo, um, upload to your LinkedIn account, the Career Center do offer some professional photo headshots in their office. So if you have more questions about that, we'll be happy to answer that later on. Here's some other unique features about LinkedIn that I think students kind of overlook a little bit. When it comes to just learning more about the field, if say like like I said right now, you're interested in doing health systems management or doing something related to health administration, I think it's also good to follow some professional programs or professional organizations that revolve around that specific field. Usually those professional organizations will have information about like seminars, or they usually talk about some conferences that's coming up in the area. So I think it's really good to really kind of follow those organizations on LinkedIn just so you can keep yourself up to date with different things. This feature right here, and I'm going to talk about the alumni feature, is really beneficial for a lot of the students I worked with in the past. I know students who are about to graduate. Some of them are still trying to figure out, okay, what's the next step? So I always kind of mention to them that, hey, go to your LinkedIn profile, follow the University of Charlotte page on LinkedIn, and there's an alumni tab, and you can actually look at the different alumni that are either in the city of Charlotte, or you could look at the alumni that studied the same major that you're studying, which is health system management. Or say like if you are wanting to go into a certain grad program, you can look at some alumni that are going to certain grad programs that you are interested in going into. And then, of course, LinkedIn is also another good job search engine to utilize too. So if you want to find a job somewhere away from Charlotte or away from the United States, maybe another country, LinkedIn might be a beneficial tool to use to find different job opportunities across the nation as well as the world. Other ways to kind of uncover hidden job markets. So definitely always look at the company's website. I also talked about the professional associations that's related to the health system management program. But definitely company websites are always going to list what they are hiring for. So take some time to look at those websites. If you're a person that is really fascinated with maybe working with Atrium Health or something like that, definitely make sure you kind of look at their website on a weekly basis just to see what they have posted. They pretty much post different jobs nearly about once a week or maybe every day, just depending on what they need at the time. Government agencies is another great way to kind of look for different job opportunities as well. If you haven't had a chance to attend UNC Charlotte's career fair, that would be another great opportunity for you to go out there and network with different recruiters and find different job opportunities or internships or even maybe volunteer opportunities. Um, Definitely, it can be very tedious, I must say. But if you take the time and kind of really focus on what you are wanting to do, or what you're trying to transition to once you graduate, that time is going to be worth it. Some other helpful tips when it comes to funding some job searches is just volunteering. I think a lot of times students are trying to jump right into finding a part-time job or maybe even a full-time job related to the program, and sometimes it's not that easy. So I tell students to maybe just volunteer with the organization, so that way, once again, that can build up your networking circle, and they can get familiar with who you are as a professional. And whenever they do have an opportunity that is open in the office, such as part-time or full-time, they can be like, hey, you've been volunteering with us for a few months now. We think you'd be a good fit for this role. Go ahead and apply. And I think also just volunteer with the organization, you kind of get an inside look of their work environment just to see if that's something that really suits your career goals. As I mentioned before, professional associations is definitely beneficial. Definitely network with professors. A lot of the professors within the health systems management program, especially the upper division courses, such as your 3,000 level and 4,000 level courses, you have some professionals who are working with different types of healthcare companies. So we have some that are working at the hospital, some working with health insurance companies, some that used to work for nonprofit agencies, some that actually work in for the state North Carolina. So definitely network with your professors during their office hours or maybe one time after class. So that way you can kind of get some additional assistance when it comes to finding some job opportunities. One thing I like to kind of express is like, what can you do with this degree? So a lot of students are kind of figuring out like, okay, what type of job responsibilities can I do with this health system management program or degree right here? And that answer is pretty long. It's pretty lengthy. You can do many things with this degree right here. So this answer is pretty much the popular, I would say, but this is not the definite answer right here. So definitely students who are going into this field, they are focusing on different things such as setting budget and managing organization finances. Some students are going into compliance work or consulting work when it comes to health organizations. A lot of students are typically working at nursing homes, maybe some doctor's offices. Hospitals is pretty popular. Government agencies or just healthcare affiliated programs, not programs, but corporations or health insurances. So here's a little list of different popular job titles for those who don't have too much experience or who are kind of going into the early entry stage of this professional field. So healthcare advocate, project coordinator, medical office coordinator, those are some popular job titles that a lot of entry level people are going into once they graduate. For those who say like been working throughout this program and you have more experience by the time you do graduate, a lot of them are transitioning to fields that are or job titles that are more so consulting or becoming a medical office manager or maybe like a clinic administrator or an analyst position. So many opportunities or avenues for you to go into. I like to show this page to students whenever I meet with them who are kind of unsure about what they can do with this major. This is pretty much a quick overview of what health systems management is and some sample occupations that are related to the program. Once again, we're not listing everything that's related to the program on this webpage, but this is just something that you can kind of get an idea of what areas you can go into after graduation. And I always tell students too, if they're not too familiar what these titles are or what these occupations are, always look it up. Definitely just type in these job positions in Google and just to figure out what these roles and comprise of or consist of, so that way you can figure out, okay, I see that project management, I need to be able to communicate with my team a little bit, or I need to be able to handle different projects. So you be able to kind of figure out what skills are needed to become a project manager or something more so like a public health analyst, for instance. You can kind of figure out what data skills I need for me to be able to become a public health analyst. And then also to give you some ideas about what some organizations will be beneficial for you to kind of follow on LinkedIn. So that way you can kind of stay up to date with this profession. Some key words to look for. We just saw a few sample occupations on a previous slide, but a lot of times when students are getting into that phase of applying for jobs, they just kind of look up these keywords, maybe in Hire Niner or maybe on LinkedIn, and just figure out like, okay, are there any um, jobs in the area or companies in the area that are hiring for these particular roles right here. And then at the bottom, you see a few sample companies for you to check out that are related to this major. So Blue Cross and Blue Shield, they definitely have some opportunities for students. I believe past summer they were looking for some interns, and so I tell students to always check out their website just to see what kind of opportunities they might have. PMMC, that's another one that I think a lot of students are becoming more familiar with. They are located in more so the south area of Charlotte. CENTA, that's a more so of a doctor's office. Of course, you got the popular Novant Health and Atrium Health. Epic is more so like the data analyst pathway when it comes to health systems management. And these are just sample companies. There's many other companies that you can look into as well, depending on where you're trying to transition into. And here's some just HSMT related jobs here in Charlotte, North Carolina. So for HM Health, I know sometimes they be looking for a patient account specialist. Flex care medical staffing, they be looking for maybe some healthcare recruiters, depending on your experience. They also be looking for some office coordinators to work with that company as well. The Mecklenburg County Emergency EMS Agency, I should say, they be looking for some analysts. They'll be hiring for some analyst positions as well too. So definitely take some time if you're about to graduate. Definitely take some time to look at some of these organizations I have listed here, just to figure out if they're hiring or if they are might be hiring for other roles. And things to remember too is that if you're about to graduate, that the job search process is very somewhat tedious. It can take up to 6 or 9 months to find some jobs or find job opportunities. So for those who are maybe graduating in December, they should maybe start looking for jobs maybe in September or October. And those who are graduating in May or in springtime, they should start looking for jobs like in January or February. I always tell students to definitely start sooner than that, just because once again it is time consuming. So, and you be applying for many jobs too when as you about to graduate. So, you want to make sure that you be able to kind of keep everything organized when it comes to what jobs you apply for and what roles that you are trying to seek out. Be active when it comes to networking too. So I always tell students once again that networking is very beneficial, just because you never know who you might come across. And then also just remain positive too. So it can be overwhelming. You might feel a little upset because you're like, okay, I applied for 80 jobs and I'm not getting any interviews. And that's okay. Don't get defeated. That's just part of the process. I would say too that whenever you start working in the field, definitely when you start gaining that full-time professional experience, whenever you transition to the next role in your field, it might be a little bit smoother just because you already have that professional experience listed out on your resume. So it's going to be difficult at first, but just keep an open mind and remain optimistic. All right. So I would like to introduce, we have a panelist here who has been working in the health administration field for about, I believe, 20 years. She is in her last semester of the Health Systems Management program, and her name is Ms. Keisha Powell. I'll be asking her a few questions so that way she can give you her insights about this field. I know I kind of gave you some information to think about when it comes to job searches, but she will be a person to definitely ask her questions when it comes to how she got to where she's at, and also be able to kind of feed off her energy a little bit about how you make that transition from undergrad to your professional field. So Ms. Keisha Powell, if you don't mind introducing yourself, and then I'll ask the first question.
Hi, my name is Keisha. This is my 28th year of working in healthcare. Um, gosh, I have a very diverse yet comprehensive background in healthcare. It's a blend of clinical and administrative experience. My journey started when I was about 16 years old, working as a CNA in a nursing home. And they helped me develop strong foundational skills in patient care and empathy. I then advanced my career through nursing roles, which allowed me to gain insight into patient needs, clinical workflows, and the importance of effective communication in healthcare. I honed my skills in operations, financial management, leading a team, and strategic planning, which are very crucial in efficient functioning of healthcare organizations. And because I had that blend of clinical and administrative expertise, my journey was definitely not linear. There were some roles that I had to take that I thought, I know more than this. And then there were some that someone just saw potential in me and just said, "Hey, try it." So it's not a straightforward journey, like you may think it may be.
Thank you so much.
Mhm.
My next question for you, Ms. Keisha, is what would you recommend students in the program, Health Systems Management program, do before they graduate so that way they can feel better prepared in the career field?
Well, for sure, one of the things that I think is overlooked in a way is joining the American College of Healthcare Executives, or ACHE. Also the National Association of Health Services Executives, NAHSE, and National Center for Healthcare Leadership. All of those, they do have hefty membership costs, but not for students. You may pay $25. And if you are in school and undergraduate, you get it for $25. But with that, for $25, you're paying for resources, mentorships, networking opportunities, webinars, and definitely you have access to the roster of who are members in each of those programs. So definitely, I know internships, everybody keeps mentioning that, and I know it may be hard to get. But see if there's someone who's in a job that you like that you really can shadow. Because sometimes what you think the role that you really want is, you'll find out after watching it, maybe that's not what I want to do. So it gives these associations give you an opportunity to speak with those people directly.
All right. And my last question for you, Ms. Keisha, is what encouraging advice will you give students graduating from the program? So those that are in their senior year and they're about to graduate, or those who have already graduated from the program. So those who might have graduated back in May or December last year. What advice will you give these students as they transition from being a student to practitioners in the field? So I know they've been students for a very long time, so that transition is a big transition. So
Mhm.
what kind of helpful advice we give those students?
Well, the first thing I would say is still to remember it's not linear.
Hmm.
So it's not, playing, just leapfrog to the next thing. Sometimes, you'll take steps forward and back. But every job, every role, and every encounter with a person is a potential connection that can add a rung to your career ladder. And nurturing those relationships can lead to unexpected opportunities and collaborations. But for the most part, it is making sure that you are upfront and honest and be authentic in what it is. I know when I was in well, this is my second degree, but when I was in school, I wanted to be a part of every club and everything because I thought that was going to be great. It looks good on a resume, but as a hiring manager myself, I can tell you, I really don't have time to look at it.
Hmm.
I may have two positions and I got 150 applicants. That's great. You were president. I'm glad you were the secretary, but why were you there? Like, what did you really try to give back to the student body at large? And especially it was something like with LinkedIn, yes, utilize it, but people know when your connections are authentic. So tell people what it is that you want up front. Tell them what it is that you're looking for, so they will be able to connect you to who can actually help you if it's not them. But to make sure that you don't forget that every opportunity is one for growth. And you're going to encounter some obstacles and unexpected changes, but to keep a positive attitude and be proactive. Um, but if you're really passionate about healthcare, it'll shine through. So stay committed, persevere, and make sure that your goal, as I tell even my team every day, the goal of healthcare is the patient. That should be your focus. You may not work with them directly, but how are you impacting that patient's life?
Awesome. Thank you so much. I appreciate that. I would like to open the floor for anybody who might have questions, either for myself or Miss Keisha. And yeah, we'd be happy to help y'all if you have any questions.
There's a question in the chat, Jalen, from Charlotte that says a lot of applications will require prior working experience for the position you are applying to. Do you have any tips on how to market yourself when you don't have that prior experience?
Oh, Miss Keisha, would you like to answer that?
So yes, in a way. So, um, first I would say what experience that you do have, you have to play that up. But also, the way that you word it on your applications and your resumes. I honestly, I'll be honest with you. I had two applicants for the same position. I had one who had a lot of experience, so I knew I wouldn't have to. The whole point about the application process is about who's going to come in. I can teach fast. They can continue making the company money, because it's very expensive to hire a person. But sometimes as a leader, you have to say, you know what? It is about the willingness and the attitude over the experience. So if you're able to come in and have that interview, you tell them up front, I'm really great at this. This is something I'm working on, and I'm quite sure under your leadership, I can, perfect those skills. You have to tell them up front that I don't know this, but I want to learn. And you honestly, one of the things that compels me when I interview somebody, when they ask me the question, will you help me? Because most people that work in healthcare are nurturers. So when you say, will you help me? It pulls that heartstring of, oh my goodness, yeah, let me help you. And I chose the person who had the least experience, and she turned out to be one of the best. And she has gone on now that she's also an office coordinator now, and she did it within 6 months.
There's another question from India. She asked, do you think we could join the program in our final spring semester and still complete everything without getting overwhelmed?
Oh, wow. So I'm assuming India, you're referring to the HSMT program. So the program consists of 11 courses, um, but that you also have to do general education requirements and other requirements too. But for the major, though, this 11 courses required for the major. So it not might be, it will be overwhelming to try to do all that in one semester. Say like if you are coming, maybe like transferring in from like another institution, or maybe transferring in from another major and you already have like previous credits, and you just want to go through this program pretty quickly, you can in a way. I always tell students to just meet with their advisor to discuss their academic goals a little bit further, because maybe trying to get through it quickly might not be the most beneficial way for you, because sometimes students that try to get through it very quickly, they will graduate and then they're kind of stumped to figure out like, okay, I did this program in 3 semesters. I don't know what I'm doing when it comes to my career field. So I understand that we all are wanting to get our degrees as quickly as possible, but it's okay to take our time. Ms. Keisha, she worked doing her program, so definitely I think it's good to be able to get that practical experience. So if you have to maybe work full time in the field and be a part-time student, I think that's beneficial because you'll be able to bring more to the classroom discussions, and you'll be able to kind of relate what you're learning in the classroom to your actual job. And you might be able to bring new ideas to your jobs too, based off the classroom discussions you were having with your professors and peers. So I wouldn't say rush it, but definitely uh, it is going to be very difficult to do all those courses your last semester. So always reach out to your academic advisor so that way we can be able to kind of organize the best academic plan for you and your goals.
Yeah, thank you, Jalen. And India said, of course, she understands. So thank you.
Yeah.
So we have another question that asks, what are some good minors paired with HSMT majors that recruiters are looking for as well?
Yeah. I'm gonna answer a little bit, and then Ms. Keisha, if you don't mind answering, I appreciate it too. I say for me, it comes down to what are you trying to get into when it comes to your career goal. So I have students who are really interested in doing more so the health informatics side of things. So I tell the students that are interested more in like health IT or health information management to maybe do a minor in data science or maybe computer science, just so they can get that data analysis skills underneath their belt. Some students are really interested in doing more so like medical sales or maybe pharmaceutical sales or something like that. So I might ask them, maybe minor in communication, so that way you can kind of understand, be able to sell things or be able to talk a certain way when it comes to that particular job opportunity. So it really comes down to your career goals. There are a lot of minors, as you know, here at UNC Charlotte, And HSMT goes pretty smoothly with any minor here. Some minors might require additional prerequisites, which is perfectly fine. I don't think that's a problem right there, but it's good to plan ahead to figure out if this minor is appropriate for when it comes to your timeline being here at UNC Charlotte.
To piggyback on that, I would say I think what I see a lot right now is everybody wants to minor in public health. And while that's good and that's great, you also have to consider how are you going to use it. So you have to figure out number one, if you are what area of healthcare that you really want to go into. Like if you everybody wants the job with Novant or Atrium. Well, the question then poses, are you looking at going into acute or ambulatory care? So, for example, acute, if you are majoring in health services management, then maybe you want to pair that with, a minor in economics or management of some sort, so that you can use it. Each area is going to require something different. So public health is good, but there are a lot of other options than just public health. Communication is a good one. But I'm not sure. I think everybody needs to kind of figure out too, their own personal branding. What is it that you really want? What is your superpower? And what is your why? So when you get up every morning and you get ready to go to work, why? We all can say money. But if it's because, hey, I love working with people, but I also love being in the background solving problems, then that's going to tell you what degree and what minor you probably need to look at. You need to figure out if you want direct reports or not, or you want to work by yourself. So all those degrees are going to aid in what type of roles you'll be able to get into.
And to piggyback off of that statement, if you're a person that don't really know your strengths or don't really know yourself on that level, Tiara or Jessica, correct me if I'm wrong, but I believe the Universal Career Center has assessments that you can do that will allow you to kind of understand who you are as a professional. So they have like personality assessments or like strengths assessments, so you can figure out like, okay, my strengths are being restorative or something like that, for instance. So maybe I should be doing something more so on the community health side to restore the issues that's going on in the community. So Jessica put in the chat that Pathway U is a great resource to figure out, who you are as an individual and understand your strengths.
Thank you. Yes, so I'm putting in the link of where it's an assessment, a career assessment, like Jalen mentioned, where you can take that for free as a student and you will get the results of, what career matches are best for you. So we have another question from Helena who asked, what type of volunteer work or additional certifications would make me a stronger candidate?
Yeah, when it comes to volunteer work, I feel like I'm repeating myself again, but it kind of goes back to what I said before, where you trying to find a job in, like what is your career goals. So for an example, if you are somebody that is looking into going maybe in the HR realm when it comes to healthcare, definitely probably doing some volunteer work, maybe at the Career Center or maybe like with different nonprofit organizations to, maybe help recruits or something like that, or help recruit people to volunteer with the organization. It really just depends on where you want to go. It's kind of not a linear answer or a straightforward answer. It just really falls back on what you want to do. When it comes to additional certifications, um, definitely, I think the more tech you go, will- the more certifications you have. If you're trying to go into like a health IT area, the more stronger you will be. But when it comes to specific certifications, I myself, I'm not too aware about what certification would be beneficial when it comes to this field. That right there will kind of fall back on your professors. So definitely talk to your professors to figure out what kind of certifications will be most beneficial to make you more marketable. I know there is a professor that teaches quality management and improvement. And I've heard from students that she always be letting students know about different certifications that are out there to help you make yourself a little bit more marketable. So definitely if that professor is telling you different certifications, if you talk to other professors, they can let you know other certifications that will help you get your foot in the door when it comes to career opportunities. Ms. Keisha, do you have like any certifications that you think would be more beneficial?
Well, first, if you know you're going into healthcare, the first one is going to be obvious. Get BLS certified. That costs the company money to do that for you. So hey, you already have that. But certifications again are going to be specific to the area that you want to go into. If you know that you want to go into healthcare management, you want to go into billing, why not go ahead and sit for billing and coding? So there are a lot of things. And again, I still echo what I said earlier. Volunteer opportunities and certifications, those things you can, the more that you are out and about, you never know who's sitting next to you and who's watching you and listening to you. So, just like for me, most of my fellow students in my class, they don't know that I work I'm in administration for Atrium. So, when you see something, you can just ask, but there's an opportunity at every turn. So even if it's something as simple as volunteering at some of the tables that are out front in front of the student union sometimes, people notice, and what's naturally you is naturally going to pour out. So I wouldn't get a certification or volunteer somewhere that is solely for my upward mobility. I would do it because it's authentically me, because if it's authentically you, you'll naturally shine at it and you'll be noticed.
And also, if you join any student organizations related to healthcare, a lot of them do some volunteer service work within the organization. So sometimes you can do both with one organization. And I'm sure, Keisha, you're part of organization too. Do you do volunteer activities within your organization or
We
committees
are.
that you're in?
Yes, we are working on it. I'm actually a part of the Health Systems Management Association. I am a co-event coordinator. Definitely join that, and it's my plug for it. Join it. You will be in a space with like-minded individuals who are at different points on their journey. So you can get someone who knows maybe a little bit more than you, and somebody who knows a little bit less than you, and you can rub together and you come out with something great. So it is definitely an opportunity. We are planning some good things ahead. So if you're not a part of it, I would definitely join it.
And you said it's the Health Systems Management Association for UNC Charlotte?
Yes, ma'am.
Okay, I'm gonna put the link. I found it in Niner Gauge, so students can click on that if they're
Okay.
interested.
Yes.
If we have time, I just have one more question for you, Ms. Keisha. So, when it comes to say like I'm gonna give you a little scenario. Say like I applied for a role in your office, and say like I submitted my application 2 weeks ago, and I'm like, okay, I want to know if I'm gonna get an interview. Will it be frowned upon if I email you and be like, hey, Miss Keisha, I submitted my application 2 weeks ago. I just want to just check in with you just to see, if I need to submit anything else to my application or maybe meet with you so that way I can give you a little bit more information about myself. Because I've had some students in the past, they're like, yeah,
Mm.
I submitted my application a month ago. Should I contact them or should I just keep waiting or what should I do? So being that you've
Yeah.
been in a hiring manager role before, um, is that frowned upon if somebody reach out to you, if they submit an application and they want to like know, hey, what's the status?
For me, no. I can't speak for all the, other
Yeah.
leaders, but for me, no. But it also, for me, one of the big things is decorum. How you start that message off. For example, I have, different people that maybe they didn't get the position and then they'll email me back, why didn't I get it? And that's what they'll say instead of, can you help me or, different things like that. So make sure that when you get ready to email a hiring manager, that you double check and recheck your wording and your tone in an email, and that you remain professional. And you even need to practice that when working with each other and your professor. You are cutting your teeth now on how to um, practice professionalism. So ask for what you want, but make sure that you do it with respect, especially if you are wanting something from somebody.
And Jalen, I'm so sorry about this question, but I missed it. Sean asked, how can someone work in the healthcare administration field while getting their master's in either MBA or MHA? Like, how can someone balance out work and school during graduate school?
I'm doing it now. So it can be done. So I balance. So this is, like I said, this is year 28 for me. I have a 21-year-old son. I have a previous nursing career. I am in a lot of things. It is organization, it is focus and determination. When you want something, you'll figure out how to do it. So be authentic, be real. Because people can sense when you're not. But for the most part, it's not easy. You really do have to want it, and you have to say no to a lot of things that maybe at one point you really wanted to do. But as I tell even my own son, college, let's just say, hey, you took your time and it took you 5 years to graduate.
Mhm.
Look at life expectancy. If you are expected to live 80 years, what is 5 years out of 80 years of your life? You lost nothing. Let's just say it took you 20 years. You still have 60 good years left. So you have to decide what it is that you want and just say, I'm going to take my time until I get there. I had to come back to school to finish a second degree so that I can take a higher position in January. And I got in gear. I said, I got to finish this, I got to get this done. And I moved to another role in January. It's about focus and being able to say no to the things that don't align with your goal and where you're going. It's some maturity and some responsibility. And again, when you want something, you'll figure out a way.
And yeah, just to reiterate what Keisha said, like definitely don't feel like you have to do your master's in 2 years. It's okay to extend that time. Create your own academic plan that's most beneficial for you. So if you're a person that want to get more professional skills while getting a higher degree, so yeah, focus on having a full-time job and maybe take 1 or 2 courses a semester, and let your professors know that too. So that way, whenever you do meet with them and they be like, hey, I'm interested, really excited about this program, but I am working full time and I plan on doing this program in 3 years or 4 years, whatever, so that way they can align your courses appropriately. Because sometimes if you don't say anything, then the program coordinator is going to be like, hey, take these 4 classes this one semester. And you'd be like, okay. If you keep your mouth shut and be like, oh, I'm working a full-time job, but my advisor's telling me to take 4 classes this semester, how am I going to be able to balance that? You got to, let them know so that way they can be able to better support you.
I mean, I think we've all heard that saying that the world steps aside for the man who knows where he's going. The path will be made clear. And again, you also do have to create that time for real self-care. For,
Mhm.
hey, I've turned in my assignments. For me, I typically work a week ahead of my assignments. So that if life gets busy, I have to get ready to return to the office next month. I went ahead and told all my instructors, hey, this is what I've got. But they know me because I branded myself as a responsible student. So they say, hey, you're going to be fine. I'll let you know if something happens. But I started here in January. True, I already have another bachelor's, but I started here in January and I finished in December, and I rolled right into the next portion of my career goals in January. And you just hunker down and get it done.
Awesome. Thank you. Those were some great answers to all that. So I hope it was helpful for everyone. And so with the interest of time, we're gonna end this session now. Keisha, would it be okay if students connected with you on LinkedIn?
Sure. Sure.
Okay.
I've got to do some more work. I ignore it so bad, so I'm gonna have to get busy. But
Well,
yes,
yeah,
that's
she
fine.
is busy, so she might not respond right away because as you can
But I
see,
will
she's a
respond.
mom, she's a student, and she's a full-time, she works full-time. But
Mhm.
if they have some more questions, you just provide so much great information and we're so
Oh,
Mhm.
thankful. So,
Yes.
and Jalen too. So make sure you make an appointment with your advisors like Jalen, because he can really give you that personalized information like he was saying. So thank you everyone for attending today's session, and I hope you have a great day.
yeah, you too.
Thank you.
Bye.
Bye.
Thank you guys.